Your spine is collapsing. And your morning glass of water might be the exact thing that stops it, if you put the right things in it. Because what I'm about to share with you contradicts almost everything your orthopedic surgeon, your chiropractor, and your physical therapist have been telling you for years. And I don't say that lightly. My name is Dr. J. Paul. I spent 2 decades working at the intersection of musculoskeletal medicine and internal biochemistry, and I have watched thousands of patients do everything right. The stretches, the posture braces, the ergonomic chairs, the cortisone shots, and still end up hunched, stiff, and in pain every single morning when they swing their legs out of bed. Not because they were lazy, not because they ignored their doctors, but because nobody told them that the structural collapse happening in their spine is not a mechanical problem first. It is a chemical one. And I'm going to give you the answer. I'm going to tell you exactly what to add to your water every morning. But I need you to stay with me for a few minutes before I do, because if you jump straight to the solution without understanding why this works, you will make the same mistake that most people make, and you will get absolutely no result. The why matters here. The why is everything. Let me tell you about a man named Robert. He was 67 years old when I first encountered his case. Retired engineer. Sharp, methodical. The kind of man who tracked everything in a notebook. He had been dealing with what his doctors called degenerative disc disease for about 9 years. His posture had shifted so dramatically over that decade that his wife told him he looked like he was permanently bracing for a punch. His lower back ached constantly. His thoracic spine, the middle portion that runs between your shoulder blades, had rounded forward into what clinicians call a kyphotic curve. In plain English, his upper back was beginning to hump. He wasn't just uncomfortable, he was embarrassed. He had been a tall man his whole life, 6'1", and now he was walking into rooms slightly folded. Robert had done everything by the book. He'd completed 2 full rounds of physical therapy. He did his McKenzie exercises every morning without fail. He slept with a lumbar pillow. He'd had 3 epidural steroid injections over 5 years. His orthopedic surgeon had told him at his last visit that the disc between his L4 and L5 vertebrae was now so compressed it was essentially bone on bone in one region, and that they should begin discussing surgical options. Robert left that appointment terrified. He was staring down the barrel of a spinal fusion procedure at 67 years old, and he was not sure he would come out the other side as the man he went in as. What his surgeon never asked, not once, was what Robert was drinking, what he was eating in the first 30 minutes after he woke up, how hydrated his intervertebral discs actually were at a cellular level. Because here is what most people, including most physicians, do not know. The discs in your spine are not passive cushions. They are living, dynamic structures that are almost entirely dependent on what you put into your body to maintain their height, their elasticity, and their ability to absorb the compressive forces of simply standing upright. And there is a very specific window, every single morning when you first wake up, when those discs are primed to absorb either the nutrients that rebuild them or the inflammatory signals that continue to destroy them. Robert had been waking up every morning and drinking plain water or black coffee, and his discs were starving. Before I go further, I want to pause and ask you something. Scroll down right now and leave a comment. Tell me your age, where you feel the pain or stiffness, lower back, upper back, neck, or all 3, and tell me whether your posture has visibly changed in the last 5 years. Just type something like 64, lower back, yes, my posture has changed, or 71, upper and lower, I've noticed I lean forward more. I read these comments. The pattern in your answers will tell you something important about what stage of this process you're actually in. Now, back to the science. Because this is where everything changes. Your intervertebral discs, the shock-absorbing pads between every vertebra in your spine, have no direct blood supply after roughly the age of 25. Let that sink in for a moment. No blood vessels run through them, which means they cannot receive nutrients the way every other tissue in your body does. They are entirely dependent on a process called diffusion. Essentially, nutrients have to seep into the disc from the surrounding tissue, driven by hydration, movement, and the presence of specific molecules that make that transfer possible. When you are dehydrated, diffusion slows. When you are deficient in the building blocks those discs need, diffusion delivers nothing useful even when water is present. The disc becomes a dried-out sponge. A dried sponge does not compress, it crumbles. And a crumbling disc cannot hold the vertebrae above and below it in proper alignment. So the vertebrae tilt. The spine curves. The muscles that were designed to hold you upright go into a chronic state of protective spasm because they are now doing the job that the disc structure was supposed to do. That spasm is the pain you feel. And no stretch, no brace, no injection addresses the reason the disc is failing in the first place. There are 3 specific compounds that research has shown repeatedly across multiple peer-reviewed studies are critical to this diffusion process. To disc hydration, disc height restoration, and the reduction of the inflammatory signals that prevent the disc from healing itself. And almost nobody over the age of 50 has adequate levels of all 3 simultaneously. Not because they're eating badly, but because the body's ability to synthesize 2 of these compounds declines sharply with age, and the third is almost never consumed in meaningful amounts through the standard modern diet. The first compound is collagen peptides, specifically type 2 collagen and undenatured collagen, which are the structural proteins that make up the annulus fibrosus, the tough outer ring of your spinal disc that keeps everything contained. As you age, your body's collagen synthesis drops dramatically. Research published in the American Journal of Clinical Nutrition has documented that collagen production begins declining in your 30s and accelerates significantly after 50. By the time most people are experiencing the posture changes and the back pain that brought them to this video, they have been running a collagen deficit for years. The disc's outer wall has been thinning for years, and the inner gel, the nucleus pulposus, has been slowly losing its ability to hold water because the container around it is compromised. Collagen peptides consumed orally, and this is the part most people get wrong, do not need to be injected to reach the disc tissue. Studies have shown that orally consumed hydrolyzed collagen peptides are absorbed intact and concentrate specifically in cartilaginous tissue, including spinal disc tissue, within 90 minutes of ingestion. The morning window matters because it is when the disc is at its most expanded after a night of lying horizontally, and therefore at its most receptive to nutrient uptake. The second compound is magnesium glycinate, not magnesium oxide, which is what most over-the-counter magnesium supplements contain and which has a bioavailability rate so low it is nearly useless for musculoskeletal function. Magnesium glycinate. Magnesium is the mineral that governs over 300 enzymatic reactions in the human body, and 2 of them are critically relevant to posture and back pain. First, magnesium is the primary mineral that controls muscle relaxation. Calcium triggers muscle contraction. Magnesium triggers release. When you are magnesium deficient, and studies estimate that over 60% of adults in Western countries are chronically deficient, your muscles cannot fully release. They stay in a low-level contraction state. They stay tight. The paraspinal muscles along your spine, the psoas that runs through your core, the trapezius across your shoulders, all of them are gripping, all the time. That grip is pulling your spine out of alignment from the inside, and no amount of stretching produces lasting relief because you are fighting the chemistry of your own cells. Second, magnesium is essential for the activation of vitamin D in the liver and kidneys, and without activated vitamin D, calcium cannot be properly deposited into bone, which means that the vertebrae themselves, the bony structures that your discs sit between, begin losing density. Compression fractures become more likely. Postural collapse accelerates not just from disc failure, but from the bones themselves changing shape under load. The third compound is MSM, methyl sulfonyl methane. It sounds like a chemical additive. It is not. It is a naturally occurring sulfur compound found in small amounts in fresh vegetables, in fresh meat, and in raw dairy, all of which are dramatically reduced in the modern diet through cooking, processing, and storage. Sulfur is the mineral backbone of collagen. Without it, the collagen your body tries to produce is structurally incomplete. It is like trying to build a bridge with steel beams that are 30% hollow inside. MSM also has direct, well-documented anti-inflammatory effects. A 2006 study published in Osteoarthritis and Cartilage found that participants taking MSM for 12 weeks reported statistically significant reductions in joint pain and improvements in physical function. Research on spinal tissue has found MSM to be particularly effective at reducing the inflammatory cytokine activity that occurs in and around degenerating discs. The same inflammatory signals that tell your nervous system to generate pain, that tell your paraspinal muscles to spasm, and that actively suppress the disc's repair mechanisms. Here is what makes the morning water protocol work. It is not just about taking these three things. It is about taking them together, dissolved in water, on an empty stomach, in the first 15 minutes after you wake up. That timing is not arbitrary. During sleep, your discs rehydrate. They expand slightly. Their internal pressure normalizes. When you first stand up in the morning, before the compressive load of the day begins, there is a brief window. Researchers estimate roughly 40 to 60 minutes, when the disc tissue is at maximum permeability. It is the moment when diffusion is most efficient. When you introduce hydrolyzed collagen peptides, magnesium glycinate, and MSM into water, and drink it during that window, you are essentially delivering the exact raw materials for disc repair directly to the cells that need them most, at the exact moment those cells are most able to receive them. I want to pause here again and ask you another question. In the comments below, type morning if you currently drink something specific first thing after you wake up, or type nothing if you just go straight to coffee or wait until later, and add your age next to it. This matters to me, and I want to see the pattern. Now let me tell you about a woman named Patricia. She was 62 when she began experiencing what her chiropractor described as forward head posture, combined with early thoracic kyphosis. Her head had shifted forward about 1.5 inches from where it should have been relative to her shoulders. And for every inch your head shifts forward, the effective weight your cervical spine must support increases by roughly 10 pounds. Patricia was essentially carrying an extra 15 pounds on her neck every waking hour. She had daily headaches originating from the base of her skull. Her shoulders ached. She had stopped swimming, which she had done her entire adult life, because the rotation required for freestyle caused sharp pain through her left shoulder and upper back. She had been told by 2 different practitioners that she needed to strengthen her deep neck flexors, to work on thoracic mobility, and to get off her phone. She was compliant. She did all of it. She improved marginally. She did not get better in any meaningful sense. Patricia started the morning water protocol. Not because a doctor recommended it. Because her daughter, who had researched musculoskeletal biochemistry after her own experience with back pain, found the research on collagen and MSM and put together the combination herself. Within 3 weeks, Patricia noticed that the morning stiffness she had come to expect, that locked, wooden feeling in her neck and shoulders that used to take 45 minutes and a hot shower to break through, had shortened to about 10 minutes. By week 6, she told her chiropractor that something had changed. He measured her forward head displacement again. It had reduced by about 1/2 inch. He asked what she had changed, and she told him. He had no framework for it. He told her it was probably the exercises finally taking effect. She knew that wasn't true because she had been doing those exercises for 14 months with no improvement before adding the morning protocol. And then there was Clarence, 71. Former carpenter, his posture problems were severe and structural. Years of physical labor had compressed his lumbar spine to the point where he was nearly 2 inches shorter than his peak height, and imaging showed significant disc narrowing at multiple levels. His pain was constant. Not sharp, constant. a dull, grinding presence in his lower back that made it difficult to stand for more than 20 minutes at a time. He was on prescription anti-inflammatories that were starting to affect his kidney function. His gastroenterologist had told him he needed to reduce the medication, but his pain without it was unbearable. Clarence was caught between two systems, the pain management system and the gastrointestinal system, and neither was talking to the other, and neither was asking about the morning, about the water, about the biochemistry that was actually driving his disc degeneration. Clarence added the protocol: collagen peptides, magnesium glycinate, MSM, dissolved in 12 ounces of warm water, taken within 10 minutes of waking, before coffee, before anything else. 3 months later, his pain had reduced enough that he was able to begin cutting his anti-inflammatory dose in half under his doctor's supervision. 6 months later, he was off prescription anti-inflammatories entirely. His kidney markers improved. His standing tolerance had extended from 20 minutes to nearly an hour. He was not cured. His structural damage was real and irreversible in certain ways. But the daily war his body had been fighting, the inflammation, the muscle spasm, the disc starvation, had quieted significantly. He told me the most important change was in the morning. That window he used to dread, swinging his legs off the bed and bracing himself for the first wave of pain, had changed. He still moved carefully, but the intensity of that initial pain had dropped to a level he described as manageable rather than defeating. Now I want to address something. Because I know some of you are sitting there thinking, if this works, why hasn't my doctor told me this? Let me be direct with you. Most physicians, good physicians, conscientious physicians, received almost no training in nutritional biochemistry during medical school. A 2019 survey of American medical schools found that the average medical student receives fewer than 20 total hours of nutrition education across 4 years of training. 20 hours. Out of thousands. So when your doctor looks at your MRI showing disc degeneration and talks to you about surgical options or pain management protocols, they are not withholding information from you. They genuinely were not given that information. They were trained in a system that is built around diagnosing pathology and matching it to an intervention, a drug, a procedure, a referral. The idea that what you put into a glass of water every morning could alter the biochemical environment of your spinal discs is not part of that training. It should be, but it is not. And the pharmaceutical industry has very little financial incentive to fund the research that would make it part of that training. Hydrolyzed collagen peptides cost roughly $30 a month. Magnesium glycinate costs about $15. MSM costs about $12. None of them are patentable. None of them have a pharmaceutical company behind them with the resources to run the kind of large-scale clinical trials that would put them on a prescribing physician's radar. The research exists. It is peer-reviewed. It is published. But it does not have the marketing engine behind it that a new biologic or a spinal decompression device has. That is not a conspiracy. It is simple economics, and understanding it frees you from waiting for your doctor to recommend something that the system has no incentive to bring to your doctor's attention. If this information has changed something for you, if you are thinking right now about someone you know who is dealing with back pain, who has been through the physical therapy and the shots and still hasn't found relief, share this video with them, right now, before you scroll away. The person you are thinking of deserves to know this. Hit that thumbs up button if this has been useful to you, and if you have not subscribed yet, do it now. I put out information like this consistently because I believe that most people who are suffering from the kinds of conditions that drove them to this video have not been given the full picture. Subscribing means you will be here when the next piece of the picture arrives. Now let me give you the exact protocol. Step 1. Immediately when you wake up, before you check your phone, before you make coffee, fill 12 to 16 ounces of warm water, not boiling, warm. Warm water enhances absorption. Step 2. Add 10 to 15 grams of hydrolyzed collagen peptides. Look for a product that specifies both type 1 and type 2 collagen, and that lists the molecular weight of the peptides. You want something under 5 kilodaltons for optimal absorption. Stir until fully dissolved. Step 3. Add 300 to 400 milligrams of magnesium glycinate. Not magnesium citrate, not magnesium oxide, not magnesium chloride, unless it is in a highly bioavailable transdermal form. Glycinate. It is the form bound to the amino acid glycine, which enhances both absorption and crossing of the blood tissue barrier into musculoskeletal tissue. Step 4. Add 1,000 to 2,000 milligrams of MSM powder. It dissolves easily, tastes slightly bitter, and is well tolerated even on an empty stomach. Step 5. Drink the full glass within 15 minutes of waking. Sit upright while you drink it. Do not lie back down afterward if possible. Light movement, or simply standing, allows the early hydrostatic loading on the discs to begin, which drives diffusion. Step 6. Do not eat for at least 30 minutes after drinking. The empty stomach state maximizes absorption of the collagen peptides, which compete with dietary proteins for absorption pathways. There is one additional element I want to address because I see it misunderstood constantly. Vitamin C. Collagen synthesis, the process by which your body takes those peptides and actually constructs new collagen fibers, is entirely dependent on vitamin C as a cofactor. Without it, the enzyme that performs the critical hydroxylation step in collagen construction cannot function. You can be flooding your body with collagen peptides every morning and producing very little new structural collagen if you are vitamin C deficient. Take 200 to 500 milligrams of vitamin C with your morning water. Not megadoses. The research does not support the idea that more is proportionally better above about 500 milligrams for collagen synthesis specifically. Just 200 to 500. That is enough to fully activate the synthesis pathway without creating the oxidative stress that very high doses can occasionally produce in certain individuals. Now let me answer the questions I know are forming. Question 1. How long before you notice a difference? The honest answer is that it varies significantly depending on how depleted your baseline levels are, how severe the existing disc damage is, and how consistently you follow the protocol. Most people report a noticeable reduction in morning stiffness within 2 to 4 weeks. Structural changes. Actual improvements in disc hydration as measurable on MRI take a minimum of 3 months and more realistically 6 months of consistent daily intake. This is not a fast solution for a structural problem that developed over years. But for most people, the quality of life changes in pain and stiffness become apparent long before any imaging changes show up. Question 2. Can this be done if you are already taking medications? Collagen peptides, magnesium glycinate, MSM, and vitamin C are generally very well tolerated and have minimal interactions with most common medications. However, if you are on blood thinners, if you have kidney disease or significant kidney impairment, or if you are on medications that affect mineral metabolism, please speak with your physician before adding magnesium supplementation specifically. This is not a substitute for medical care. It is a biochemical support protocol that works alongside whatever care you are already receiving. Question 3. What about the collagen in bone broth? Bone broth contains collagen, yes, and it is a worthwhile addition to the diet. But the concentration of hydrolyzed peptides in even a high-quality bone broth is inconsistent and generally lower than what the research suggests is needed for measurable therapeutic effect in disc tissue. Think of bone broth as a dietary complement, not a replacement for the morning protocol. Question 4. Does this work for everyone? No, nothing works for everyone. If your disc damage has progressed to the point of severe nerve compression, if you are experiencing numbness, weakness in your legs, or loss of bladder or bowel function, those are medical emergencies that require immediate evaluation. This protocol is for the far more common experience of chronic postural decline, morning stiffness, generalized backache, and the slow forward collapse that most people over 50 begin to notice. It does not replace surgical intervention when surgical intervention is genuinely warranted. But in my observation, The vast majority of people who are being moved towards surgical conversations are not yet in territory where surgery is the only option. They are in territory where the underlying biochemistry has never been addressed. Before I close this video, I want to hear from you one more time. Go to the comments section right now and leave one of three things. Type "starting tomorrow" if you are going to try this protocol. Type "already tried collagen" if you have used collagen before and tell me whether you saw a difference. Or type "questions" if something I said raised a question you need answered before you feel comfortable moving forward. Your comments drive what I cover next. They also remind me exactly who this work is for. Let me bring Robert back for a moment. Robert, the engineer with the notebook, the man who had been told his spine was essentially bone on bone and that surgery should be discussed. Robert started the morning water protocol 3 weeks before his surgical consultation was scheduled. He went to that consultation. He told the surgeon what he had started. The surgeon told him it couldn't hurt and it couldn't help, and that they should schedule the procedure. Robert scheduled it. And then he deferred it. 3 months. He kept the protocol. He kept his exercises. At 3 months, his morning pain had dropped from what he described as a 7 most days to a 3 or 4. His wife stopped commenting on his posture because his posture had visibly improved. He is not a new man. His disc at L4-L5 is still compromised, but he is standing taller than he has in a decade. He is walking his neighborhood again. He has deferred the surgical conversation indefinitely, not because he is in denial, but because the trajectory of his condition has reversed direction. And that reversal started with 12 ounces of warm water every morning. You don't have to wait for your next appointment. You don't have to wait for your next MRI. You can start tomorrow morning. The window is there every single day. Use it. If you want to go deeper on spinal health, specifically on the connection between gut inflammation and disc degeneration, which is the next piece of this puzzle that most people are completely unaware of, that video is available right now. Click on it before you do anything else. The information in it will change the way you understand why your back pain keeps returning, no matter what you try on the surface. Don't wait on it. Click now, and I'll see you there.